Hello everyone. We are Group 8. Our group members are Yihong, Sibei, Wenxu, and CHONGYAO. Today, our topic is research on wireless portable blood glucose meter. So, what is blood glucose meter? It is equipment can let patients get their blood glucose concentration fastly. So there are two kinds of blood glucose meter in the market. The first one is the traditional one, and the other one belongs to the new high technology Raman spectroscopy meter. So traditional blood glucose meter, which I think everyone used to see it before. It's just like use a pin to stick on the finger, get some blood collect on the testing strap, and the test meter will tell you what is the blood glucose concentrator is. However, certain people have used to see the Raman spectroscopy meter. It is belong to the new high technology, use the lasers to test our patient's glucose meter, glucose concentration. Sorry. So let's turn to the next page. So firstly, I want to introduce traditional blood glucose meter first. Maybe we have used to say this. The official name is called glucose oxide Sibei electrode. Normally we call it blood glucose testing strap. So how to use this testing strap? So the main part of how it works is called the oxide Sibei. When I just said use pin to stick on the finger, drop blood. When patient's blood touches the testing strip, it will have chemical reaction. So this reaction is called a redox reaction. This chart will illustrate how the reaction happens. When blood touches the Sibei, so the glucose in the blood will have reaction with Sibei. Since there, glucose will be turned into gluconic acid. At the same time, H2O2, which is hydrogen peroxide, and electrons will still be appears. So if we give the voltage on the meter, and it will cause current fluid. So according to the in the laboratory test, we found that the strength of current is in linear relationship with the blood sugar concentration. So by reading the current of the meter, we can find the concentration of the blood glucose. So what is the advantage and disadvantage of the traditional blood glucose machine? Blood glucose meter. So the first advantage is it is fast, only needs 30 seconds to get to know the result. And to the disadvantage, I think it is much more than its advantage. The first disadvantage is it had to use pin to stick on the fingers. Firstly, it will get the higher rate to get infection. So the second disadvantage is it is painful. So last but not least, the last disadvantage is the cost. For example, use this testing strap once a day, but the diabetes mellitus patient may get the illness for more than 20 years. So day by day, the cost on the testing strap will be uncountable. It will be a hard burden to the patient. So, is there anything new to instead the traditional old ones? Yes, there it is. It is what I'm going to introduce you. The new blood glucose meter, which is called Raman spectroscopy blood glucose meter. So, what is the difference between it and the traditional one? Significantly, the advantage of it is it doesn't no more need to pin on the finger, get some blood to collect, and mirror to test. It uses lasers which is called the phantom scattering to test. So as we know that in the laboratory research, we found the molecular vibration structure to different molecules different. So which means if we test the glucose molecule, we'll find it is unique molecular vibration structure, just like its fingerprint is easy to find. So according to this chart, it is from the blood glucose concentration from 5% to 30%. It's obviously found that at 5%, the glucose, the wave of the displayed on the computer is like that, and with higher concentration of blood glucose, the higher wave it has. So that is the principle of how it finds our blood glucose concentration. However, there still have some technical challenges we have to solve. So the first one, it is from the laser. As lasers may hurt our skins. However, it have to flash under the skin to test our livers and test blood. So the first challenge is we have to find glucose without hurt our skins. The second one, our skin is not like just a mirror face or water. It doesn't have such strong ability to reaction. So how could we let lasers flash through our skin and get a clear reflection with the information about glucose? The second is the cost. I think it is a disadvantage, but it is still an advantage. So the disadvantage is this part of equipment may not be so cheap as the traditional blood glucose meter. However, if we think furthermore, every day we need to use a blood testing strip. However, day by day, year by year, if we use this new technology, we no more need to use blood testing strip, which will make our save a lot of cost on the consumable testing equipment. So then I will talk about the market of this new technology. Firstly, why we need a blood glucose meter? According to the IDF data, 382 million of people get the illness of diabetes mellitus, and over 5 million patients have died. So what is diabetes mellitus? It is an illness that patients almost lost half or all the ability to create insulin. Insulin can help patients to reduce the level of blood glucose. However, as patients lost the ability to create all the insulin created without any works, it will cause the heart rate to control of blood glucose. As a long time, it will harm to our organs or even cause failure. So, with a blood glucose machine, patients can fastly understand how the blood glucose concentration is, and by this data, they can do the suitable way to solve the problem and get control to the blood glucose concentration. As new technology can significantly change our lives, it can also help us do some improvement on the blood glucose meters. This is the part of various part that can help to increase the the route between patient and doctors. The new technology information science can also help do some improvement in blood glucose meters. The communication part that is embedded in the blood glucose meters can send information to the doctors once the patient does test by their blood glucose meters. So the information sent to the doctor can help doctors do the better ways to own their patients and help the patient be cured faster and yes, more steady. So this is the part that information can change to our topics. So thank you very much. That's all for today's topic.